Good afternoon and
Good
happy
afternoon.
Sunday to everyone.
Thank
Good
you.
afternoon.
Welcome to GUYDA's first webinar on a topic that has affected us in so many ways. COVID-19 has affected so many areas of our lives. My condolences to those of us who have lost loved ones to this virus and during these unprecedented times. Today's webinar takes the form of a panel discussion on the impact of the COVID-19 pandemic on the youth of Guyana. Thanks to those of you who are able to join us today and to engage in this topic. We're very excited to have you. We're using the Zoom platform where you can see and hear the panelists live. We will disable the chat feature and you will have the opportunity to pose your questions for the panelists during the Q&A feature of our discussion, which will be about 15 minutes before the end of the program. We will begin with a moderated panel discussion followed by a Q&A session as time permits. Before I introduce the panelists, please join me in welcoming the president of GUYDA, Mr. Leslie Stewart, who will tell us a little bit about GUYDA. Thank you. And again, please engage with us. Mr. Stewart.
Thank you, Madam Moderator. Good afternoon, ladies and gentlemen. It is my distinct pleasure to welcome you to GUYDA's presentation of this panel discussion on the impact of the COVID-19 pandemic on the youth of Guyana. As president of GUYDA, I'm extending this welcome to you on behalf of the officers and members of the association. GUYDA is the acronym for the Guyana United Youth Development Association. It is a non-for-profit corporation based in New York and comprises of members who reside both in New York and other parts of the United States as well as in Guyana. This corporation was established in May 2005, primarily to promote social and educational opportunities and training for youth in Guyana and in the United States, so that they can become productive citizens. In keeping with this mission, we are staging this panel discussion to inquire about the effects of the COVID-19 pandemic on the youth of Guyana and to provide a conduit to assist them in coping with both the mental and physical adverse effects of this pandemic. I am sure some of you would like to know what GUYDA has done and is doing for youth in Guyana well. GUYDA has been making annual contributions to assist the following programs in Guyana. 1, the literacy program in Sophia on the east coast of Demerara. 2, the school for special needs children in Diamond on the east bank of Demerara. The Gordon family to assist students in New Amsterdam, Berbice. And of course, we are a staunch supporter of the STEM program in Guyana. It should also be noted that GUYDA is currently providing scholarships to 2 students attending the University of Guyana and provided a scholarship to a student who attended the Wooden Law School in Trinidad, graduated, and is presently practicing law in Guyana. To assist in this COVID-19 pandemic, GUYDA is presently providing funding for the Bagotville Seventh-day Adventist Church on the west bank of Demerara to distribute food hampers to assist families in that area, and also providing funding to God's Battalion Church in Charity, Essequibo Coast, for food hampers to assist residents of Charity and Jackalope community in the Pomeroon. This is just a snippet of what GUYDA does. Please visit our website, www.guyda.org, to be further acquainted with GUYDA and its missions, as well as its programs. You must remember that influence without affluence is a hallmark of GUYDA. Let me repeat that. Influence without affluence is a hallmark of GUYDA. Therefore, we need your donations for us to continue influencing the youth in Guyana as well as in the United States of America. Please go to our website, and I repeat, www.guyda.org, and donate. Thank you for participating in this panel discussion. Be blessed. And thank you, moderator, and back to you.
Thank you, Mr. Stewart. Now, please allow me to introduce our expert panelists. Dr. Astell Collins, kindly raise your hand. Let us know who you are. Dr. Collins.
Hi, good afternoon.
Good afternoon. Dr. Collins is no stranger to us. He's working with the youth development and works internationally with the youth. He's one of Guyana's distinguished youth ambassadors and has received 2 honorary doctorate degrees. He's a well sought after speaker in Guyana as well as on the international front. Dr. Collins lives in Guyana with his family. We are so happy to have you with us. Dr. Richard Van West Charles, kindly raise your hand so that we know who you are.
Good to be here.
Dr. Richard Van West Charles is a doctor of medicine with years of experience with the World Health Organization and in the area of public health, including research and bioethics. Dr. Van West Charles lives in Guyana with his family. We are pleased to have you with us also.
Good to be here.
Reverend Richard King, kindly raise your hand so we know who you are. Thank you. Reverend King is the pastor of God's Battalion of Prayer Center in Charity, Guyana. He's a former teacher and is now committed to addressing the spiritual needs of the Charity and Essequibo community. It's a pleasure to have you with us, Reverend King.
Thank you, Dr. Hamilton.
Mr. Pierre Squires, he was having internet trouble logging on from Guyana. Nevertheless, I'm going to introduce him. Mr. Squires, did you come on as yet? I'm going to introduce him. Mr. Squires is a prospective graduate of the University of Guyana and a first-year student of the Hugh Wooding Law School. We're so happy that you can join us. Miss Makisha Stewart, kindly raise your hand.
Hi, good afternoon.
Good afternoon. Ms. Stewart is a high school student in Guyana and plans to pursue a career in business management. We are happy that you can join us. Ms. Joanne English, kindly raise your hand. Ms. English, I know she had come on. I don't know if she's having internet trouble also, but nevertheless, Ms. English is a teacher with several years of experience in Guyana. We're so pleased to have you with us. Mr. Victor Phill, kindly raise your hand so that we know who you are. Mr. Phill is a licensed mental health clinician with several years of experience in mental health in New York City. We're so happy to have you with us also, Mr. Phill. I am Dr. Sherry Hamilton, an educational consultant with several years of experience in the field of education in New York City, as well as the chaplain of GUYDA. Please join me in welcoming our panelists. Now let's begin. COVID-19 has affected so many lives throughout the world and has had an even more devastating effect on the United States of America. We're told that persons 65 years and over and those with compromised immune system are vulnerable to this disease. But we've also seen cases where younger persons have contracted this virus, and some of you have even died from it. Even children in our schools have been affected. Dr. Van West Charles, can you tell our audience how many cases of coronavirus there are in Guyana and how many have died from this virus?
Thank you very much, Dr. Hamilton. Good afternoon to everyone. As we speak, up to today, the total number of positive cases are approximately 3,798, with 118 deaths, with a distribution of about 2,006 males and 1,792 females. The total number of persons recovered will be 2,785. I would say to you, in terms of the regional distribution, Region 1, and presently Region 1 is described as a major hotspot. You probably would have read of the outbreak in Guyana, which is a satellite community in Region 1. And so that entire community is on lockdown as we speak. Region 4, which is Mahika Demerara, which has approximately 1,767 cases, 68 that is. And the next hotspot would be Region 9, which has Region 7 and Region 9. Region 7 having about 349 cases, and Region 9, 378. You may have seen a slight dim in the lighting, but we've got a blackout and my generator is now about to kick in. In terms of the male-female distribution, you would have discerned that there are about more males than females. 63.8% of the deaths are male and 36.2% females. So basically that's the distribution as we speak.
Thank you so much. Now, you talked about the male-female ratio. What about persons ages like 14 to 40?
Right. So if you look at the bunching, you can see major bunching between, in terms of the positive cases, between the age group of 15 to 39. And, but in terms of the deaths are going into the age groups beyond 50, basically, the majority of the deaths. But the distribution of the deaths remain in pattern, in the global pattern of more males than females.
Thank you so much, Dr. Van West Charles. Now, I read in the Caribbean National Weekly, they reported that September proved to be one of the deadliest COVID-19 months for Guyana. Why might this be?
Well, I think what is happening is, like in most countries, I don't think we are doing we've stepped up the testing somewhat, but you're not doing enough contact tracing. And I think also we've got a problem in terms of behavior change on the part of the citizenry. So despite the fact that you're hearing a number of ads, and you're hearing the ads, especially in terms of the Amerindian dialects, you are still seeing the spikes in Region 1 and in Region 4. Now, and 7 and 9. Now, you have to bear in mind that Region 1, 7, and 9 are border regions. Region 1 borders with Venezuela. We've had a movement of migrants into Guyana because of the situation in Venezuela, and also movements into Region 7. And then you've got the movements from Brazil into Region 9. These borders are not simple borders to police, so no matter how you lock the borders down, people will move. And so then the issue is the understanding of the population to prevent transmission. So although we're saying that you have to wear the masks, I was coming back this morning from Barticle. I saw 2 truckloads of young people, none of them wearing masks. So it is a problem of compliance, understanding the transmission, and the invincibility of youth. Now the question is, the youth may not die as quickly as the elderly, but they're in contact with their grandmothers. And then we do have a problem of housing density in this country. So especially within the regions I mentioned, regions 1, 7, and 9, where there are generational families and they all live. We know that there are housing density issues in these regions and in Region 4 and the other regions. So this becomes a challenge if the population is not yet clearly understanding the need for compliance with these procedures.
Thank you for sharing that. You mentioned about the issues with the testing and tracing and the spikes, especially in certain regions, as well as coming down from Bartica and noticing young people not wearing masks. Now, what advice are Guyanese given in order to protect their health and safety?
Well, they're given the advice. The issue, like everything else, is what monitoring system is in place to ensure that people adhere. If there are no sanctions and they're applied quickly, you're not going to necessarily get, in a matter like this, the behavior change. And even in the offices, and we're preparing, for example, to open up schools. I do not personally think that everything is ready for the schools. The water systems, the sanitation blocks, the sanitary blocks, etc., are in the best of shape. So I think we are going to see, once they proceed with it, a manifestation of more problems among the youth, the school-age children, because of the basic preventative methods that should be adhered to. So the teachers will not be able to police all of these kids. So I think it's very important that we think carefully. And then again, where Guyana is at serious risk is that we haven't got, if the percentage increases and people have to be hospitalized or require ICU care, we haven't got the number of beds to take care of. We are, I think, at the moment bursting at the seams.
Wow. Thank you again for sharing that information. You mentioned about the monitoring and sanctions, and those things definitely are critical. But are there any restrictions that have been put in place?
Well, you have in some private and public sector um, entities, you cannot enter without a mask. So that's one good. You have to wash your hands.
Mhm.
But I mean, I stood there and looked at people wash their hands, and really the water is running, a little soap on it, and they are washing their hands.
Mhm.
So again, it's not, I don't want to say the word police, it's not monitored properly. And therefore, people will do their own thing because they go, yes, you have to go and wash your hands, the tap is turned on, and then you either the soap may be out because sometimes the soap is not there, so they just run their hands on the water, and there may not be paper to dry their hands. But then again, to get into the entity, you have to hold the door
Mm.
and you have to pull it open. So all of these things, these changes have not been made to really look at it in its totality. But I don't want to say that nothing is done. Some of the entities really they have the temperature guns. At this stage, I don't think, for me, I don't think the temperature guns are either here nor there. Certainly the masks, the social distancing, the hand washing, very, very critical. We have coming down again from Bartica today, there's somebody at Rockstone who is taking your temperature, takes the temperature. But if my temperature were high at that point, what can she do? You know? So it's not done with a level of seriousness because not far from her post, a set of kids again without masks, all gathered together, and no social distancing. So these are things that I think would require a bit more rigor, a bit more monitoring, compared to how things are done in Canada, another country that I know reasonably well. In terms of monitoring, if you are quarantined, you are called and checked on regularly to be sure that you are in the home. But
Yes.
I know people are quarantined, but they are out. You know, so those are some of the challenges we have in like many other third world countries.
Thank you so much. And I know you mentioned you're seeing especially young people with no masks and the social distancing and things like that. I want to just go over now to Dr. Collins. Dr. Collins, what are you seeing from your vantage point as someone who is so deeply involved with young people? What are you seeing? Dr. Collins, can you hear?
I had the mute on.
Okay.
Yeah. In addition to what Dr. Van West has said, it's a similar, not the strict adherence to the rules, and there are guidelines which have been, which have been promoted adequately. But I believe there is not this seriousness, especially amongst the young people. And I think I want to start with early is that they have a sense of fatigue, the quarantine fatigue. But there are stations where before you enter a building, you have to wash. But again, you have to hold you have to open the door so your hands become contaminated again. But there are businesses that sometimes have someone designated, not only to open the door, but to spray your hands. I heard it said that they said their hands are taking in more alcohol than from their mouth, the amount of alcohol. And I think there's a fear of being overly sanitized, whereby you wash it, then you sanitize your hands. And some people argue that something about having good bacteria and all of that. So there's a debate now on this, this excessive caution, so to speak. But you find that I think more could be done in terms of adherence, but it's not to say that the guidelines are not there. I mean, we hear it over the radio, on television, even on social media. So the guidelines are there, but I believe the commitment to be serious about it at all times, especially when you're outdoors, I think that has to have a bit more hammering home, so to speak.
Mhm. Thank you. And we have some young people on our panel. I want to go over to them and just to hear from them. What are you seeing in terms of, from your vantage point, among your friends, your colleagues, in terms of, are they following protocols? What is happening? And I'll ask Pierre Squires. Pierre was able to join us. I think I saw that Pierre was able to join us.
Yes, good afternoon, everyone.
Good afternoon.
Well, from my perspective, I have noticed, well, some young people, they're following the protocols, and some others, they aren't following the protocols as well. So what I noticed is that there aren't some younger persons going out and liming, as we'd say here in Guyana, as much as they'd used to before the pandemic. There's also some job opportunities that they'd become involved in. For example, they'd work from home. There's also an internship opportunity I know of that allows them to work from home. And this could be a good indication that some protocols are being observed. There's also the option of them, well, they're also forced to, some of them wear their masks. I noticed that some young people, they'd wear their masks. And before they enter into these public buildings, they'd have to wash their hands, and they'd have to wash it for a long period, like for 30 seconds, or well, at least 30 seconds. And on the other hand, there's some other younger people, they're not following these protocols. They're still going out to these public spaces. They're going, for example, to the seawalls. They're having these surprise parties, and they're not following the protocols. They're still gathering and not doing so well. And you'd notice as well, they're not even wearing their masks, and they're wearing their masks. When they wear it below their noses, and that's not the correct way for them to wear it. I believe that some of them, they have the feeling that they're immune to this virus, or they won't get as sick as many other persons would if they get the virus. So that's how I've noticed some younger persons behave with this virus. Yes.
Thank you. Thank you for sharing that. Makisha, would you like to add anything to what Pierre just said?
Yes, good afternoon once again. What I've noticed is that some young people aren't adhering to the restrictions, whereby they say wear a mask, sanitize regularly. For instance, some of the young people go out and they socialize with their friends, and when they get back home to their peers, they forgot to wash their hands, and then they go about touching stuff, which can cause the spreading of the virus. Okay, so some of the restriction that Guyana put out there is to wash your hands regularly, wear your mask, and to always be sanitized. Some of the young people do follow these rules, while others are getting it in their head that the older folks can contract this virus more than them, and that their immune system is more better than them, which is not partially true, right? Once you contract this virus, you do not know until 14 days until these symptoms show up. You can get it more worse than the older folks. So my advice to the young people is to just adhere to the rules, and most obviously the cases in Guyana and across the world will eventually drop.
Yeah, that's good advice, Makisha. Thank you for sharing that. Now, I want to go now to education and schooling, because that COVID-19 has caused a great disruption in schooling and education here in the United States of America. So I want to just go over and ask you, what is happening? How has COVID-19 affected education and schooling? And I'm going to ask Pierre, you want to take a first shot at this?
Yeah, sure. Well, COVID-19 firstly affected my schooling to a great extent. We essentially had to move away from the tradition. Firstly, our classes, we were prevented from in-class gatherings. We weren't able to meet up in our classes to have the in-class sessions where the lecturers would, provide us with information and notes and all these other lectures. And we were also prompted to do this 24-hour exams, in which we had a lot more information and a lot more questions to answer than the usual 2-hour exams that we've had before the pandemic. So essentially, we had to move away from the tradition. We had to become more adaptable and more resilient to adopt some measures to allow us to be examined, and at the same time, have to observe these social distancing measures that we are really supposed to in these times. So, yes.
Thank you. Makisha?
COVID-19 have affected me during the pandemic. I was preparing for my CXC exams, and coming on to March, where Guyana saw its first case, it kind of disrupted my focus a little bit. So we had to move away from the normal stuff that we do, whereby we socialize with our peers or we teach one another and stuff that we don't understand. So coming on to online classes and learning via technology. It was a bit challenging for me because I usually go to my teachers to be one-on-one so they can pinpoint certain things, especially in the mathematics area, because it's kind of difficult to learn maths through the screen for me, but eventually I still got through with it. And I know it's a little bit tough for some of the students because they didn't have the technology to use. We had to go by neighbors or corner shops to get internet to try to learn these basic topics. So it was a bit difficult for me going through this COVID-19 pandemic.
Thank you, and congratulations for forging forward and getting through with your studies. I want to go over now to Miss English. Miss English is with us. She's an educator. And just to find out, how are school leaders and teachers addressing the challenge of ensuring that learning continues?
Okay. Teachers and leaders are addressing the challenges of learning and education being continued. It is indeed a challenge, but learning must continue. First of all, it's a new area, it's a new thing for Guyana to have online teaching, and so it needs additional training for teachers and parents together, because the parents are the one that has to supervise and be with the children on a day-to-day basis. The virtual teaching and on a digital platform, some parents are unable to cope with it. And so it's a challenge for them to cope. They cannot shuffle work, household chores, and then have to supervise their children. It's a hard challenge. And also we have the challenge of age group, where the attention span for the younger ones are very short. So they have to take into consideration the challenge of having young ones to teach where their attention span is short, and they must fill the gap with other things, not teaching all the time because they would lose their interest.
Thank you for sharing.
Some parents cannot operate their digital devices. They cannot. And so that's a challenge also. Also, not being au fait with the curriculum. Even though the work is there, some parents cannot cope with it. They do not understand what is going on. So that's a great challenge. That's a big challenge for them also. So also the supervising of children. Children need constant supervision when they're doing their work. In school, the teachers are there. At home, parents might not be there because they have to go to work. Who is left to supervise the children? They are left on their own most of the time with an elderly sibling, and they work as they feel like, meaning they do whatever they want. Instead of doing the schoolwork, they find other things to do on the digital devices, which take away the interest. I have been visiting one of my friends, and I saw where one of our nephew had work to do on Zoom, and he was sitting at his desk with the computer on, but his attention was on us. While we were talking, he was joining in the conversation. And many times I had to turn to him and say, are you doing your work? The focus and the attention was not there. The aunt could not have done anything because she don't know what he's doing there. She cannot cope with that. So that is a disadvantage for children, not having supervision and proper supervision to continue their work. So that's a great.
Thank you. You mentioned several of the issues regarding this. And what's interesting also, I read the Minister of Education who mentioned that some of the challenges that you just described, and she talked about even more so, more pronounced, especially in the more rural areas where electricity and internet access are limited. And we have in our midst Reverend King, who is from out of the greater Georgetown area. So I want to go to Reverend King and ask Reverend King, what are you hearing? How are parents and the children like in the community there, how are they doing with this?
Good afternoon, Dr. Hamilton and all the others on the panel. It's a blessing to be with you. And I agree with the previous speakers that education is seriously one of the more hard-hit areas, especially in rural Guyana. In Essequibo, what has happened is that the children's routine of going to school Monday to Friday, 5 hours a day, has been completely disrupted, and it's been so for many months now. So up to recently, I saw a group of probably 12 to 15 primary school age boys, probably under 12, each with a bicycle, just riding around. Because the challenge of staying focused on the schoolwork is big for them. On the other hand, the access to the internet. There are quite a few of the children whose parents have internet at home and they have digital devices, they can access it. But like our previous speaker said, having the parents supervise them is a challenge. But out here, there are many families that do not have internet access. Some folks have digital phones, but it costs them a whole lot to put credit or minutes on the phone for them to access the internet. So education is one of the things that gets thrown by the wayside. And again, if you were to put minutes on the phone or credit on the phone and give them internet access, it is true. We cannot control whether the children will actually do their schoolwork or look at something else, because there's so much on the internet that would be of greater interest to them. I think one of the underlying issues that shows up, especially here in rural Guyana, is the value that we have placed on education over decades. It shows up now that the interest in education, both for parents and for students, is not always there. So definitely there are challenges. I find what has happened recently is that some of the schools have started to distribute worksheets and workbooks. I think the Ministry of Education has printed some workbooks, and so those are becoming available, and we hope that the children will use them. But again, there should be a monitoring system. Some of the teachers I know are sending work out on WhatsApp to those students who can receive it. But then the teachers are pleading with the children to either return the work, the finished work via WhatsApp, or to bring the work to the school so the teachers can check it. But that is a problem because who's going to ensure that the children actually get the work back to the teachers so the teachers can mark it? So there are quite a few challenges.
Yeah. And you know, it's interesting that you said that too, because that's one of the things the Minister of Education said, where they're distributing workbooks and worksheets to the students in order to address the learning loss that might have occurred as a result of the schools being shut down. But like you said, in terms of supervision and monitoring, those are some other issues that even that presents. So I want to go back now to the question of the idea that the children are out of school and they're not socializing in the way they were used to. What effect is this having on their social emotional health? And I'm going to ask Pierre to jump in here. What effect is this having on their social emotional health?
Well, as a student of the University of Guyana, back then, last semester, I often feel like a relief sometimes of being on campus and being among my peers. With these persons who I have so much in common with, these persons I can discuss assignments and all sorts of things with. We can sometimes even go out after classes and, you know, socialize and, you know, we could intermingle with each other. And given that there's a pandemic now, there isn't that possibility for us to even meet up. I haven't even seen so many of them ever since before the pandemic even began. And there's also this interesting point, I believe, that especially with the younger students, like primary school students and nursery school students, I recall when I was in, well, when I was at those stages, I would often look at my report card and there's this assessment by the teacher of how well the student would cooperate with their peers. So I believe that given that there's this pandemic and these students, younger students, they're now, you know, so isolated, there might not be the possibility of that assessment for the teachers to find out how well these students would cooperate with their peers. And I believe that could have some social effect on the student at that young age.
Thank you. Makisha?
For me, while I was away from my peers, I felt a little bit bored because you're around these people most of your life. You share a common relationship with them. At a point in time, some of the students got bored being away from their friends because we normally around them you have a sense of belonging, you feel comfortable, you can share ideas, you can share stuff that you're going through or not, or with somebody that is more trustworthy. Emotionally they will feel a little bit drained. For me, I wasn't drained because I kept in contact with my peers, but for others I know they'll feel like, okay, we are accustomed to being around these people for 8 hours. Now we are only seeing them via technology. I wonder if they're feeling well or not. Right? So you're trying to like, they're like affecting them mentally and socially, I should say, as youths of Guyana. So it's like a little bit you're feeling a little bit depressed, not knowing who to turn to because in school normally there's a counselor that you can go and talk to them about anything. Whereby now some children might not be comfortable speaking to their principal certain stuff because of the way their parents might react in a certain way. So not having that individual around might just cause a little bit effect on them in a way, I should say.
Thank you for sharing that. I want to scoot over now to Dr. Collins. Dr. Collins, as someone who's interfacing with young people, what are you seeing in terms of how is this pandemic affecting the social, emotional, and mental health of young people?
Well, I believe it has an impact in a sense whereby I look at my own son, who is 8 years, and his interaction now have been restricted to a digital interaction, and even with his cousins. And you find sometimes too that even when given the opportunity to like take a drive with me or go out and play, they prefer to be on the internet. And I think there's these games now that creates a virtual reality, which encourages more distancing. But I think for those who are a bit older, there is more of a, like when Dr. Van Westchar saw them, the kids in the creek, not wearing masks. Sometimes you see them drinking. Most times now you find some of the youths are on the seawall. They have drinks at the back of a car with loud music. So it encourages them to disregard the caution that has been enforced. And you find that there is this relaxation and because we are social beings, there's a need to socialize. So there are times when it's only so long and so much we can, restrict them. But they find creative ways of getting out there. And sometimes that causes a recklessness that you find that there's a spike. But again, the statistic shows that even though they're infected, they recover faster. So even that gives them a sense of invincibility and more carelessness. So you find, and there's one instance in particular where I spoke with a girl working at a bank, but she's doing an online course. But oftentimes, like the speaker before me spoke, that they want to socialize. So she went into a bout of depression and confessed to me that she also entertained suicidal thoughts, which I find very revealing. I've often found people, doing crazy things on social media out of their character, which they would not have done ordinarily. But I've never heard someone wanting to commit suicide. So I think that is something we have to investigate and see how the impact of this isolation has caused on our young people's social and mental state.
And I'm glad that you raised that too, because this is a good segue for the next question, because the social, emotional, and mental health and the effect that that this pandemic is having on the social, emotional, and mental health of not just young people, but everyone here in New York City. So we have on our panel here Mr. Phill, who is a licensed mental health clinician. So I want to direct this question now to him. Can you give us some strategies that our young people, not just in Guyana, but here also in the United States, what can we do in order to address our social, emotional, as well as mental health?
Thank you, Dr. Hamilton. We're in the midst of an unprecedented physical and mental crisis. People are experiencing difficulties in adjusting to the impact of this pandemic. To overcome these challenges, it's important that we be resilient. So the question is, how do we develop resilience? We can use mindfulness relaxing techniques to focus on the here and now. Mindfulness helps us reduce anxiety and depression. It teaches us how to respond to stress with awareness with what is happening in the present moment. By just taking a few minutes to sit in silence and take some deep breaths, helps us to relax and focus on the present. I also would suggest creating a morning routine. Exercise daily and try to get enough sleep. We know that exercise helps us to deal with stress. We heard of social isolation. It's important to take a walk in the park and enjoy nature. I also would recommend starting a journal and document each day how you're dealing with COVID. List things you're grateful for. Also, try to reclaim long neglected hobbies, whether it's sewing, whether it's knitting, whether it's jogging. It's important to do that. Try to communicate with friends and family, and it's important to support each other. Bridging relationships, very important.
Thank you, Mr. Phill. You mentioned the importance of staying connected with family and friends. And with the holidays approaching, people will be experiencing the holidays now in new ways this year. So many have lost loved ones. There'll be that empty seat at the table, as well as with social distancing, with people not being able to gather and celebrate in the way they're used to. What signs should people look for that may be indicative of depression? Dr. Collins mentioned depression. He mentioned about suicidal ideation. Makisha also mentioned about depression. And so what signs should people look for that may be indicative of depression?
Yes, we need to look out for symptoms of depression, feelings of hopelessness, loss of appetite, excessive sleeping, social isolation, poor hygiene, mood swings. These are symptoms that if you know anybody, any relative, close friends are experiencing any of these symptoms, it's important to check that person out, okay, so that they can get the proper counseling. If someone you know is suddenly giving away their cherished belongings, such as jewelry, pets, cars, then this is a red flag. The person may be having suicidal ideations.
I will charge you.
Also, I think it's very important to practice cognitive restructuring, which is replacing stress-inducing thought habits with less stress-inducing thinking habits. We practice this when our patterns become destructive and self-defeating. Take a break of consumption of fake news and make sure you're following credible sources.
Thank you, Mr. Phill. Thank you for sharing those strategies that we can actually use and those red flags that we can look for. Now, how can organizations such as GUYDA be of support to our youth and families in Guyana at this time? We do hear of a lot of the needs and a lot of the challenges. We heard about challenges with the technology. We heard about learning loss. We heard about even the counseling area and the support in terms of the social emotional health. We heard about the challenges with training for the teachers in terms of using the technology and the virtual platforms. So how can organizations such as Guyana be of support to our youth and families in Guyana at this time? I'm going to ask Pastor King first to take a shot at this, because GUYDA has already started some work. So can you share with our audience what is happening in that area? What has GUYDA been doing, and what else can GUYDA do in order to support our youth and families?
Thanks again, Dr. Hamilton. Well, GUYDA has been kind to us at God's Battalion Prayer Center by providing us 2 disbursements of financial resources, which allowed us to provide food hampers in the first instance to 53 families, in the second instance to 65 families at Charity and at Jacklow on the Pomeroon River. That has come in handy. There are a number of those persons who have said that it was very timely, because given loss of business, loss of work, having children at home all day, all night, it was very helpful that they got those groceries, those food hampers that did help them. I think one of the things we have to look at too is, especially for the children who really want to learn, because there are some children who really want to learn, but they're being hindered. And I don't know how GUYDA will be able to help those children at this point in time, because some of them will need like cash advances for their credit on their phones to access the information coming from their teachers. Some of them might even need an internet-ready phone and the training.
Okay. Again, internet issues, I guess Reverend King is having some internet trouble. So In the meantime, I'm just going to ask Ms. English, can you jump in there? How can GUYDA be of support? I know you're familiar with what GUYDA started to do already in Baggotsville. So could you share that with our audience, and what else can GUYDA do?
Okay, GUYDA has been of a great support to the Baggotsville Seventh-day Adventist Church. We have been getting donations from GUYDA, and we have been doing distribution in our communities. And with each donation, we have been sharing out 50 food baskets. We are very grateful and thankful for the donation from GUYDA because it has gone a far way. Many families share their gratefulness with us, and we want to say thank you. GUYDA has been doing a great job. And ways that GUYDA could continue to help, one of the ways that GUYDA could continue to help is to have a counseling program. Young people need counseling. Not only young people, families need counseling in this COVID-19 pandemic. Some are throwing their arms up. They don't know what else to do. And if we have a counseling system where families and individuals can come in and be counseled, I think that would be a great asset for GUYDA. Also, they can share out literature to children, little readers that they can read. The children can read. They can be assisted at home and help them to read. These would go a far way because they're out of school. They don't have much to do. Those who are coming to lesson are coming to lesson. They are getting the assistance. But what about those parents who cannot afford to send their children to lesson? They are left hanging around, just running around the place, liming on the road, and all the rest of it. So if GUYDA could come in there with some little literature for the children, where the children can read or be assisted by parents or guardians or whatever to read, it would be a great asset. Also, GUYDA could also have shelter for those who are not working, those who have knocked off their jobs. So when they cannot afford to pay the rent, they have a place to go. Many families their parents have been laid off their jobs. Some are not working, especially teachers. They are not working. And the rent to pay, it's a monthly process. But one day, they wouldn't be able to pay it anymore. What next? GUYDA could come in there and have a shelter. So when this happens, these families can have a place to rest their head until further.
Thank you, Ms. English. Thank you for sharing that. What about Makisha? How do you see GUYDA as an organization can assist?
I see GUYDA as an asset to Guyana by where they can collaborate with the Ministry of Education, where they can work along in providing worksheets for the children of the smaller schools, like the primary school, the nursery school, and if possible, the daycare. Going around in different regions, dispatching these useful information to the children, whereby the secondary school children now can be equipped with a use of tablet for those who don't have this equipment in school or provision of Wi-Fi. They also can help by donating hampers to those that are in need that doesn't have food stuff in their homes, contacting the neighborhood democratic council to find out those homes that needs these food hampers and that can help out in any way possible.
Thank you, Makisha. Pierre, how can GUYDA be of support?
Yes, I also agree with Makisha. GUYDA can make these collaborative efforts with the Ministry of Education. I believe I heard recently that the Ministry of Education, they reached out to these communities and they provided these blackboards for the various communities and for the students to meet and have their classes. I believe that GUYDA can also meet and reach out to these other communities that haven't the resources as yet, or that the communities that the ministry hasn't reached already, and provide these assistance, whether through these chalkboards, through exercise books, through other learning materials that the students can use to help them to cope with this pandemic and to actually get their work done for school. And I believe that I also agree with with Reverend King when he discussed the hampers and the other services being given to the communities. I believe that is a very good initiative, and if it can continue to some other communities that would really be in need of the assistance, that would be greatly appreciated. So thank you.
Thank you. Dr. Collins, how do you see GUYDA being of support to our youth at this time?
I know that GUYDA has actually, I'm on a ship, so please forgive the noise. I know that GUYDA has already provided, I believe, tablets or some computers, but that too would be appreciated. But beyond that, as I think that Pastor King spoke about connectivity, I am aware that there is a system where you can actually have one router or you pay for one system, but you route it to a street. So if GUYDA can assist in not only providing tablets and perhaps computers for families that are deserving, but also find some way to help them with the internet. I know you may, because what I've known is that in a particular street, I think it's Leopold Street, they actually use the community center, put the internet hub there, and then just like have relays where and then it's by a voucher. So the kids are only allowed if they have the voucher. So it's only kids who are in classes, and then how they set it up, it's limited. You can't go on Facebook, and so you can only do research. So it's not that they're wasting it. So there's a way where I believe if GUYDA can provide tablets, but also some way to provide some amount of connectivity.
Thank you. Thank you. Now, any last comments from any of our panelists? Any?
I just wanted to make a quick comment on education. The introduction of the virtual environment, I don't think was well studied. And maybe because of the emergency situation, they weren't well prepared. But applying the virtual environment to your traditional mode of presential teaching, there is going to be a mismatch. And I don't think the teachers are prepared in a way to work in a virtual environment. And I think where GUYDA's headquarters is situated, you should be able to assist either the Teachers Union or the Ministry of Education with some professional and development of working, how teachers work in a virtual environment, how they prepare their lessons, and what has got to be done. Because children may be in quarantine, or children may be in hospital, they may be in isolation. That doesn't mean one of the good things that the technological environment or platform affords is that you can be in class wherever you are, or you can do asynchronous learning. So it's to combine the two. I think to GUYDA, I feel where you are, you may be able to seek some support, run a few seminars for teachers working in the virtual environment, and how you prepare your lessons, etc.
Thank you. Thank you. Anyone else? Okay. So, and to our audience, any questions for our panelists? So our time has been well spent. And on behalf of the officers and members of GUYDA, I thank our esteemed panelists for engaging with us in this discussion on the effects of COVID-19 pandemic on the youth of Guyana. I thank our audience for joining us. You have heard from our panelists regarding how we can support our young people in Guyana. GUYDA has begun some of this work, as you heard, only because of your contributions, only because of your donations. Please visit our website, www.guyda.org, and donate to these efforts. You heard of the needs just mentioned, the food relief to be continued, the internet access, counseling programs, providing readers and other workbooks, collaborating with the Ministry of Education, providing tablets, looking to assist in the virtual platform, in conducting seminars. We could only do that with your support. So we want to continue to provide scholarships, school supplies, food relief. Some of you might have heard recently about our efforts with the STEM program, which was highly publicized, literacy programs, and even programs to address social and emotional needs of our young people. So we want you to give generously. Visit our website in order to do so. Also, you can surely become a member also of this organization by visiting our website and joining us. Also, you can give up your time and your talents by contacting us on our website. Our next event is our fundraising gala, which will take place on December 5th. Visit our website for more information. This recording will also be available for a few days on our website and Facebook pages for those of you who would like to give others the opportunity to hear it. We will also post some resources on our website that you can use to share with others to address our social and emotional well-being. I want to also thank Raul De Silva, our producer, for assisting us in producing this event. I also want to thank Carl Osborne and the GUYDA Tech team for your assistance in helping us put this webinar together. Let us continue to be safe, whether you are in Guyana or in the United States. Mask up, as we heard. Social distancing, we heard that these are the things that work. Hand washing, sanitizing, as Dr. Van West mentioned. There's a way to do the hand washing in a proper manner, sanitizing. And for our listeners here in the United States of America, don't forget to vote. God bless you and have a good evening.